Hi. No, I'm at the doctor's. I just wanted to get that rash checked out. I know, I wanted to have a doctor look at it, and my mom has no idea. No, babe, I'm sure it's nothing. See you at school later?
Isabella? Isabella Estevez?
Yes, that's me. Gotta go, Whitney.
Isabel.
Isabella.
Yeah. So, any changes from last time?
I have a rash. It's very...
Right. How long have you had it? Where is it?
It's been a couple of weeks. I thought it may go on away by itself. It's down.
Can you show me where it is?
It's down there. Should I put on a gown?
No, just pull down your pants and I'll take a quick look. Okay, thanks. Here's a prescription for an ointment.
How long will it take to go away? And do you know what it even is?
Just keep using the ointment until it's gone. Make another appointment if it gets worse. And make sure your boyfriend gets tested.
I don't have a boyfriend.
Well, you are sexually active. How many partners do you have?
Just one.
I'm confused. I want to run a pregnancy test while you're here. You have an STI in your vaginal area, so that means you're sexually active. And if you're not using protection, there's a pregnancy risk.
I don't need a pregnancy test, and I don't have a boyfriend.
Can we get a pregnancy test for, Isabella? They'll be right with you.
Mom, why didn't you say anything?
What was I supposed to say? This better not cost me anything.
Hey, maybe we can grab a bite to eat after your appointment, if you have time.
Okay, sure, sounds great, Mom. I hope they can get me in soon.
Beth.
Right here.
The doctor's ready for you. Come on.
Now let's make sure you give the doctor lots of information today, Beth.
Yep, got it. No worries, Mom.
Okay, well, you know, I worry about you. I have to do my mom thing. And you just need to tell the doctor everything and ask lots of questions. It's all about you, so you're in charge.
Yeah, well, the last doctor I had to call during her visit, so if she's at least interested, I'll be happy.
Yeah.
Hello, ladies. I'm Dr. Rogers.
Oh, hi.
How are we all doing today?
Oh, fine, thank you.
She's doing much better than me. It's not her appointment.
Don't worry, we won't be too rough on you.
I have a list, so hopefully that helps.
Great. I love it when my patients come in prepared and are ready to go. So we're going to start by Mom having you wait out in the waiting room. There's a lot of magazines out there for you to read, and we'll come back and get you at the end of the visit to make sure you don't have any questions.
No, I'm fine. I'll stay with Beth.
No, really, it's okay. I'll have you wait out in the waiting room, and we'll come back and get you at the end of the visit.
Yeah, come on, Mom. It'll be fine. I'll be out in a little bit.
Okay. See you soon, sweetie.
So since you're a new patient, I've already reviewed your chart, and I just wanted to take this time to talk and kind of get to know you better.
Cool. Thanks for that. She can be a little much.
I want you to remember that this appointment is about you, so everything that we say today is confidential, and just to make sure that you're comfortable with talking. So do you have any concerns or any questions that you have for me?
I'm good, but I have been seeing this guy for a while.
So have you guys started having sex yet?
Yes, but I've also started seeing this girl a couple weeks ago.
You look a little concerned. Is there anything I can help you with?
I've only been with her a couple times, but I really want to understand the risks of multiple partners and having sex with men and women. I'd be mortified if my mom found out. Is there anything you can direct me towards to clarify some of the information for me? Maybe something on the web? Anything that can't be found in my bag or in my room?
Well, the first thing I want you to remember is that sometimes parents can be a little difficult to talk to, but remember that they have your best interest at heart. So when you get comfortable, you should probably have a conversation with her. I'll take a look and see if I have any handouts or anything from the internet that I can give you to help answer some of your questions. But I do have a couple questions for you. Have you ever been tested for any sexually transmitted diseases?
Never?
All right. And it's nothing to be ashamed about or embarrassed about. It's just something you should have done when you start having sex. It should be a routine thing just to make sure that you're healthy and that you don't have anything. The second question I have for you is, are you guys using protection?
I use condoms.
Great, that's awesome. I just want to say that I appreciate your honesty and your willingness to be so open. I know sometimes it's difficult to have these type of conversations, so I think you did a great job today. Thanks, Beth.
Thank you.
Hi, I have an appointment with Dr. Simon.
Mariana Flores.
Mariana Royes.
You're late. Dr. Simon, you have a patient.
Thanks.
Mariana Royes. Exam 2.
Okay, so anything else other than the pain you had mentioned?
Well, nothing this week, just the pain. It's pretty bad, and it's been on and off for a couple weeks. I think it's getting worse.
I'm sure, yeah. I'm going to prescribe you a topical pain medicine and get you some condoms. Will that take care of you for today?
Why do I need condoms, and what's this medicine about it? Do I need to know anything else?
It's just a topical cream. The pharmacist will let you know all about it. Everybody needs condoms.
Yeah, but what's this pain I'm feeling? I mean...
I see this all the time in girls just like you. Trust me, it'll go away. We're good here though, right? Yeah? And you're good and you're current on all your insurance?
Seriously? I mean, I was hoping I could get an STD test.
Sure. Can we order an STD test? Nurses will take care of you.
Okay, great.
Hi, Jay. How are you?
Hi,
it's
nice
great
to
to
meet
see you today. You're looking great. How are the roommates?
We're good. Thank you for asking. That's very kind of you.
You're welcome. So how can I help you today? How can I make your life better?
Well, my throat has been hurting. It started about 2 weeks ago. I made a list like you told me to, and I've taken some ibuprofen, and I've even taken pain relievers and drank coffee, but nothing seems to work. I just want to feel better so I can be on top of my school and work.
So I commend you for wanting to do well in school and work, and thank you for keeping a list, because that definitely helps. So what I would like to do for you today is to do an exam, and then we may need to do blood tests. It all depends on what I find on your exam, and then we'll take it from there. Is that all right with you?
Yeah, sounds good.
Perfect. So what I would like to do first is clean my hands, and then I'll take a look at you. So this might be cold because of the gel. Is it all right if I examine your neck and take a feel for any soreness or tenderness? All right, so let me know if any of this hurts.
Yes.
Okay. I also would like to take a listen to your heart and lungs and see how they're doing. Is that all right?
Yes.
Perfect. Let's take a listen. And all I need you to do, Jay, is just take some deep breaths, all right? Perfect. And then if I could listen to the front to listen to your heart, is that all right?
Yes.
All right. Excellent.
Thank you.
You go in for an exam, and the doctor or the nurse tells you, take off your pants. You don't know, you're just like, whoa, startled by that. You really don't know, how do you react to someone telling you take off your pants? If somebody in the street told you that, it wouldn't be okay. Just because you're a doctor, you shouldn't just tell someone to take off your pants. Maybe you can say, oh, it's time to do your exam. We'll need you to please take off what you're wearing right now and put this piece of cloth on, you know? Just nicer, better terms.
When you ask me when the last time I had sex was, make sure you ask if it was with a boy or with a girl. Remember, not everybody is having straight sex.
that I've been to the doctor a couple times, and they tell me, what are your symptoms? And whenever I tell them that I feel nauseous, they quickly assume that it's that I'm pregnant. And they want me to get a pregnancy test, and then they tell me like, but I'm not, and they insist and they insist and they insist upon it, and it just makes me feel like they're stereotyping me.
And my advice to all doctors is to install a conversation with you, so that even if it's a little conversation, just so that you can feel more comfortable with them and actually share your honest opinions about everything.
It's your job to tell me how the medicine works. So can you please explain to me how it works? Can you sit down with me for 3 minutes and ask me how my day goes? Ask me if I need anything, more than do I have more questions? Can you suggest any questions to me? Am I different? No, I'm not. I'm a daughter, I'm a friend, and I'm also a sister. So can you please treat me like one?
Get to know your doctor. They are people too. You should be comfortable telling them anything. They need to know your sexuality and your sexual activity. Remember, what is said in the doctor's office stays in the doctor's office.
Before you go to the doctors, take a moment and relax. I listen to music and read my list of questions while waiting to be called. Remember to stay mindful and aware so that you can communicate with your doctor.
Don't feel intimidated by a white lab coat. They're your doctor, they're there to help you. Don't be afraid to be yourself. Write down your symptoms. Like as soon as you start feeling bad, write them down. So when you go to the doctor, you won't forget and you won't be like, well, I forgot what it was. Like you'll be ready, and you won't get nervous when you're talking to the doctor, because sometimes it is intimidating.
When talking to your healthcare provider, always remember to
be as open as possible to get the best result out of your visit. Talk to your provider about
attraction to same sex or opposite sex, sexual activity and history, smoking, alcohol, or any other drug abuse.
Also, physical symptoms, any use of other over-the-counter medications, and unusual sleeping patterns. Be as comfortable as you want to be when talking to your provider.
Sometimes going to the clinic can be scary, so bring a friend or parent for support.
Don't be afraid to ask any questions or talk about how you are feeling.
So my advice would be to other young women and men to just ask questions to the doctors, even if you don't know these terms. You can ask them, well, can you elaborate more on it, or be more specific? Why did I get sick, etc.
Hey you, yeah, I'm talking to you. I know you could be scared going to a doctor's office sometimes, and I know that maybe you may not have a connection with your doctor, but you know that you could always ask a nurse to be present, or you could ask for an alternative doctor. Don't be scared to tell your doctor the symptoms you may be going through or what you are doing behind closed doors. You know that they can't tell your parents.
And if you think you have symptoms of an STD, please tell your doctor so that they can better treat you and your partner. It doesn't matter if you're gay, straight, bi, lesbian, transgender, whatever. It's still sex.
Empower yourself.